Hello, I'm Maria St. Hilaire. Today I'll be discussing ethical issues in research surrounding communication. I'll be discussing 6 objectives, the first being identifying the principles of scientific communication. Second would be to explain the ethical implications in human research as it applies to allied healthcare professionals. Third would be analyzing the ethical issues around communication when conducting research in the allied healthcare field. Fourth would be to describe how we would communicate effectively and appropriately with our patients, families, and healthcare providers within our scope of practice. And last would be explaining how we would demonstrate effective skills in writing formal correspondence to communicate information and ideas. There are 5 principles to scientific communication. The first being understanding our audience. Tailoring our message to the intended audience, consider what is essential for them and the frame of their communication and frame our communication accordingly. The second would be interdisciplinary collaboration, recognizing that no single expert can cover all aspects of a complex issue. Interdisciplinary teams enhance problem-solving and decision-making processes. The third is to tell a story, helps engage the audience. The fourth would be considering the messenger. The character and public perception of the communicator matters. Be aware of how our message is received in a socio-political context. And last would be making it personal. Connect with our audience by making the message relatable. Use personal anecdotes, experimental data, and relatable examples. According to 5 basic principles of Successful Scientific Communication Academy of 2021, effective scientific communication is crucial for advancing healthcare, promoting evidence-based decision-making, and reducing misinformation. Ethical implications or considerations in human research are crucial for maintaining the well-being of participants and ensuring the integrity of scientific investigation. There are 8 principles to apply, and they are informed consent. This means explaining the study, purpose, procedure, risks, and benefits in a clear and understandable manner. Participants should voluntarily agree to participate without coercion or pressure. Similar to the Tuskegee syphilis study, the Nuremberg, and those bacteriological warfare in Japan. Those were all uninformed consents. Those were all manipulated and coerced into doing those experiments. Second would be privacy and confidentiality. Confidentiality agreements ensure that data collected during research remains anonymous and is not disclosed without consent. Third would be autonomy. Respecting participants' autonomy, allowing them to make informed decisions about their involvement in research. We should honor our participants' choices even if they differ from our own recommendation. The fourth implication would be beneficence. Making sure that we have a duty to promote the well-being of our participants. Research should aim to benefit individuals and society. Balancing potential risks with benefits is essential. Fifth would be non-maleficence. We must avoid harm to our participants. This includes minimizing physical, psychological, and social risks associated with research procedures. The sixth would be equity and justice. As healthcare providers, we should ensure equitable access to research opportunities, avoiding discrimination based on factors such as race, ethnicity, gender, or socioeconomic status is crucial. Seventh would be transparent reporting. As healthcare providers, we should accurately report research findings, including any adverse events. Transparent reporting contributes to scientific knowledge and helps prevent biased interpretations. The eighth would be, as healthcare professionals, we must disclose any conflicts of interest that could influence research outcomes. Transparency builds trust and ensures unbiased results. When it comes to ethical issues around communication, we need to consider several things. One is patient partnership and informed consent. Ethical issue with this is that involving patients as partners in research raises questions about informed consent. Researchers must ensure that patients fully understand their role, potential risks, and benefits. Recommendation would be transparently communicating the purpose of the study, the risk, and expectations to the patients. Obtain informed consent that respects their autonomy. Another consideration as far as ethical issues would be resource allocation and scarcity. Limited resources such as funding, personnel, or equipment can impact research quality and patient care. Make sure that we prioritize resource allocation fairly and transparently. Consider the impact on patient outcomes. Dual loyalty and conflicting interests. Healthcare professionals may face dual loyalty, balancing their duty to their patients with their organization or military obligations. Establish clear guidelines for managing dual loyalties, prioritizing patient well-being. Research integrity and data accuracy. Ensuring accurate data collection and analysis and reporting is crucial. Uphold research integrity by avoiding data manipulation, plagiarism, and selective reporting. The fifth would be a cultural sensitivity and diversity. We need to make sure that our research involves diverse patient populations that require cultural competence. Acknowledge cultural differences, respect diverse perspectives, and tailor communication effectively. Privacy and confidentiality is crucial. Safeguard patient privacy during data collection and dissemination. Adhere to the privacy laws and regulations and protect patient identities. Power imbalance and vulnerability. Research hold power over patients. Vulnerable populations may be at risk. We want to make sure that we foster open communication, empower patients, and address power imbalances. Collaboration and authorship. Properly attributing contributions and authorship can be contentious. Clearly define roles, acknowledge contributions, and follow ethical guidelines. Conflict of interest. Researchers' financial, professional, and personal interests may influence study, design, or reporting. Disclose conflicts of interest transparently and manage them appropriately. Last would be our patient autonomy and decision making. Balancing patient autonomy with shared decision making in research. Involve patients in decisions that impact their care and research participation. Ethical communication in allied healthcare research involves transparency, respect, and commitment to the patient's welfare. According to BMC Medical Ethics, research practitioners and institutions must navigate these complexities to uphold ethical standards and advance healthcare knowledge. Effective communication is essential in healthcare to ensure positive patient outcomes, build trust, and foster collaborative relationships. Here are some strategies for communicating effectively with patients, families, and healthcare providers. First is making a positive connection with our patients and their families. According to an article by Vigo et al. In 2002, some key points would be when patients and physicians communicate well, outcomes are better and patients are engaged in their health care. Making a non-medical connection with a patient at the beginning of the encounter takes 1 to 2 minutes, but can improve a patient's perception of the interaction. Agenda setting, open-ended questions, reflective statements, and visit summaries are strategies that can improve communication without adding much time to the visit. Second strategy for communicating effectively and appropriately would be agenda setting. Allocate a time at the start of the visit to discuss a patient's concerns and priorities. Again, use open-ended questions to elicit their agenda. Understand their expectations and address any immediate worries. Actively listen. Listen to your patients without interruption. Show genuine interest in their story, their emotions, and experiences. Patient-centered communication is making sure that we understand our patients' perspectives in their illnesses. Express empathy and validate their feelings. Acknowledge their concerns and fears. Effective handoffs among healthcare providers. Use a structured communication tool and standardize handoff processes during care transitions. Transmit essential patient information accurately and efficiently. Bedside shift report is an example of this. Doing bedside shift report in the patient's room gives them a sense of teamwork and inclusion into their care, and they're free to ask questions or bring up concerns that they may have during bedside shift report. Last would be assertive communication. When collaborating with other healthcare providers, we must be respectful and direct, clearly convey our necessary information, and express our needs. Remember, effective communication is not just about conveying medical information. It's about building trust, understanding patients' unique needs, and fostering a compassionate environment for our patients and their families. Demonstrating effective skills in writing. Effective written communication is essential for conveying information and ideas clearly and professionally. Whether you're writing a formal letter, an email, or drafting up a report or other documents, there are certain strategies that would help with writing these. The first would be identifying your goal. Clearly state your purpose or objective in the correspondence, whether it's requesting information, providing updates, or making proposals. Ensure your goal is evident from the onset. Our tone and our formality. Making sure that we choose the right tone. Consider the context and the audience once again. Formal letters, memos, or official emails typically require a professional tone. Adjust our language accordingly, and perhaps avoiding medical jargon, especially when it comes to discussing things with our patients. Clarity and conciseness, keeping it simple, stay on topic, making sure that we avoid unnecessary complexity and that we keep to relevant information. Fourth would be composition, making sure that we're proofreading, that we are spelling and our grammar ensures correct. Errors can undermine our credibility. Paragraph structure, organizing our content logically. Break up long paragraphs and readability. Active voice, making sure that we use our active voice in our writing more direct and engaging. For example, instead of saying, "The letter was sent," say, "I sent the letter." Edit thoroughly. Review and revise. Edit our correspondence carefully. Eliminate redundancies and unnecessary words. And proofreading. Check for typos, punctuation errors, and clarity. Sometimes having someone else double check our work or our correspondence helps, having that second pair of eyes. Remember, effective written communication demonstrates not only our ability to convey information, but also our professionalism and attention to that detail. Thank you for your time in listening to this presentation.